Good morning, and welcome to all of you. Oops, I shouldn't show you this slide yet. First of all, welcome our members, guests, and friends, those of you here in the room, and those joining us via live webcast. It's a great honor to be addressing you today as your president. Now, I understand that 650 people have registered to attend in person. I guess a few people are still in bed. Another 600 by webcast. To me, it's quite a showing of interest and support for this topic. It's wonderful. I'd like to take a moment to acknowledge the past presidents of National Academy of Medicine who are present. Harvey Feinberg, Stuart Bondurant, Sam Thier, David Hamburg. I thank you for all your past leadership and your current support. So, at last year's annual meeting, we celebrated the launch of the National Academy of Medicine, which I will call NAM at this point on, and the 45th anniversary of the Institute of Medicine, the foundation on which our academy is built. Together, we've achieved much in our first year as NAM, and there's still much to do. John F. Kennedy once said, "Time and world do not stand still, and change is the law of life." These words ring so true, especially today. In about 3 weeks, our country will elect a new president and a new Congress. And whoever is elected, and for our sake, I really hope the right person, she or he will be grappling with the same challenges in health and medicine with which we are all too familiar. What are those? How do we accelerate progress towards a U.S. health system which will deliver better health, high value, and of course more equitable for everyone? How can we ensure that science is valued and has the robust funding needed to thrive? How to respond rapidly to new threats such as Ebola or Zika, threats that are not only national but international in scope? And how do we as a nation, irrespective of our race, gender, education, and political alliance, work together to improve the health for all? Now, as the premier advisor to the nation, the NAM stands ready to provide guidance to the next U.S. administration on these changes or challenges. That is why we launched the bold initiative called Vital Directions for Health and Healthcare, to which many of you have contributed. The initial focus of this initiative is on identifying policy and actions that could yield timely, measurable progress towards 3 key goals for the U.S.: better health and well-being, high-value health care, and strong science and technology. So to begin this, we convened a distinguished steering committee made of nation's leading healthcare and policy experts to guide the initiative. And they in turn identified 19 priority focus papers within these 3 overarching goals. We commissioned experts' paper on each of these topics. So from nearly 150 nations' leading researchers, scientists, and policymakers. And the views of these papers, of course, are those of the expert authors and not a formal consensus process. Nevertheless, the NAM's role was to conceptualize, convene, commission, and communicate, the 4 C's I call it. Now, the result of this initiative is a rich, deep resource covering the breadth of the most crucial challenges in health today. As you can see in this slide, from a systems approach to life course, to social determinants of health, to specific conditions such as mental health and aging, and from payment reform to accountable care, to workforce development, and importantly, strong science and technology, IT interoperability, the importance of data, and training for the 21st century science. As you can see, these 19 papers were published as an NAM perspective on September 19th, and a companion series of JAMA viewpoints was published a week later. On that same day, we held a major symposium here in the NAS auditorium called a National Conversation. That meeting helped stimulate input from a broad range of voices, with more than 500 people participating in personal webcasts. We held this event because we want to learn directly from stakeholders about the issues they believe are most important. And today at the President's Forum, later today at the end of the day, we'll be talking with Tom Daschle, Risa Lavizzo-Mourey, Mike Levitt, Larry Tabak, and Mark McClellan about vital directions, and we want your active input and share your thoughts with us. The next step is for the steering committee to write a synthesis paper informed by these conversations that crystallizes all of the information we gather into actionable directions. So with your input, the priorities identified will inform incoming U.S. administration, Congress, and health leaders across the country about how they can and should make real measurable improvements in health throughout 2017 and beyond. So I think you can see that we're still in the midst of doing this, but we have a very active plan in order to be actively engaged with the next U.S. administration about the next steps. As the foremost academy in health and medicine, we stand also ready to work with our friends and partners internationally to address global health challenges. With the recent Ebola and Zika outbreaks, we have worked tirelessly to convene the best minds to address the problem of emerging infectious diseases through many workshops and roundtables. And importantly, last year we commissioned a report on global health risk framework of the future, a blueprint for countering international infectious disease crisis. This initiative was launched in response to the Ebola crisis in West Africa, which more than 11,000 people, as you know, lost their lives. That tragedy was a major wake-up call for the global health community. It was woefully unprepared to handle the outbreak. On the urging of our NAM member, Dr. Jim Kim, the President of the World Bank, and with the encouragement from Margaret Chan, Dr. Margaret Chan, Director General of WHO, and our keynote speaker today, and the generous support of 7 foundations, our Academy quickly convened an independent international commission of experts in finance, governance, R&D, health system, business, and civil society. Several of our members served as commissioners. They're Paul Farmer, Maria Ferreira, Julio Frank, Larry Gostin, Francis Osmawa, and Tachi Yamada. The Commission recommended a 3-pronged framework to counter infectious disease crisis. First, strengthening global and regional coordination and capabilities to respond to epidemics with a re-energized WHO. Second, build public health and resilient health systems globally. And 3, accelerate R&D to counter the threats of infectious disease. You know, the report took a very unique approach to framing the issue, spotlighting the pandemics as a major global economic security risk. You know, it's sad but true that sometimes when we frame issues purely as a matter of health or healthcare, it may be quite hard to capture the attention of government leaders. Oh, it's another budget. They want more. But in this respect, we led with the message that in addition to killing tens of millions, pandemics could cost in excess of $6 trillion in the 21st century, or an expected economic loss of more than $60 billion a year. So we describe pandemic as a neglected dimension of global security. The report argued that compared to what we stand to lose, investing $4.5 billion a year in preparedness response, or just 65 cents per person, is a small price to pay. Indeed, when you think about what the global community spends on high-profile threats such as human and economic security, such as war, terrorism, nuclear disasters, financial crisis, it's a very small piece of what we're already spending. While some may still feel this is a steep investment, I think it will pay dividends by protecting human lives and livelihoods and safeguarding the global economy against incredible damage pandemics can cause. As the Ebola pandemic showed us, we really underinvested and underprepared. So I'm really glad this report has and continues to help shine a global spotlight on these issues. We had a very active dissemination strategy. We launched a report in New York and Hong Kong early this year. We were planning a launch in Africa in conjunction with African Union. This and other related reports were widely discussed at World Economic Forum in Davos, at the WHO Executive Board, the World Health Assembly, World Bank Annual Meeting, and it also informed the G7 World Leaders Summit in developing their position on pandemic preparedness. It has been cited in numerous journals, articles, and op-eds. You know, I'm very proud of this impact of this initiative, and I extend my sincere thanks to all of you who lent your expertise to this project. And I want to thank Dr. Chan, Margaret Chan, for her support and receptivity. And of course, we're grateful for her leadership and for the action she's taken to prepare the world for future outbreaks. As you can see, in our first year as a full-fledged academy, we've been quite busy. We're already making impact in the US and globally. But one thing that both these efforts have in common is their reliance on the expertise and insight of the NAM members and other experts who volunteer their time and talent to help us make a difference. This is why it's so important to be an academy of the high standing and excellence. Becoming an academy was an achievement, as you know, decades in the making. It reflects the great professional distinction of our members and your significant contribution to health, science, and policy. So today, I'd like to take time to recognize and celebrate our members. Can you find yourself up there? Where's Waldo? NAM members are elected by their peers in recognition of outstanding achievement. And today, our national and international membership represents more than 2,000 of the world's leaders in health policy, in health, and biomedical science. Our members have made breakthrough discoveries, cured diseases, tackled global pandemics, developed novel therapies, and innovative care delivery models, and led the way in proposing and implementing policy changes that have advanced health for us all. You truly represent the best and the brightest, and you are at the cutting edge of major scientific breakthroughs. You are the architects of significant field advances both here and US and abroad. You are exceptional health practitioners, researchers, and academics. And through your commitment to volunteer service, you help guide the work and advance the mission of the NAM, and of course, also of the rest of the national academies. This slide shows you some of the recent recognitions of our members. Just last year, Paul Modric won the Nobel Prize in Chemistry for his pioneering work on DNA repair. And this year's new member inductees include May-Britt Moser, Edward Moser, winners of the 2014 Nobel Prize in Chemistry, Shinya Yamanaka, the winner of the 2012 Nobel Prize in Physiological Medicine, who's actually here for the induction this weekend, and 2007 Nobelist Mario Capacci. We're thrilled to welcome them aboard, and I'm sure that we're all looking forward to working close with them in the future. Just last month, William Kaelin, or I call him Bill Kaelin, and Greg Semenza received the Lasker Award for basic medical research. And this past year, Albert Bandera, Stanley Falco, Rakesh Jain, and Mary Claire King received the National Medal of Science. And more recently, Cato Lorenzen, Mark Humanian, and Joseph DeSimone received the National Medal of Technology and Innovation. But the accomplishments of our members are not limited to innovation in science technology. We have global humanitarians among our ranks. Denis Mukwege from the Democratic Republic of Congo was elected last year, and that same year he was awarded the European Union's prestigious Sakharov Prize for his long-term commitment to protecting the victims of gang rape and sexual violence. Within our membership, we are fortunate to have great scholars and educators. For example, Abraham Verghese was a 2015 National Humanities Medalist. Now, these awards and prizes are wonderful, but they don't come even close to fully conveying the incredible breadth of our members' contribution. I can say without a doubt that the field and the state of health in our nation and the world won't be where it is today without you, our members' courage, vision, and leadership. And we're incredibly fortunate at the National Academies to be able to draw upon your diverse range of expertise and experiences. What's more, your level of engagement with the NAM and National Academies is really, truly, and remarkable. Remarkable. Sorry. Truly remarkable. Got it? So I'm proud to report that nearly 20% of NAM members participated on National Academies committees. That's 20% of 2,000. Just last year, the highest participation rate of all 3 academies membership. We're not competitive. The vast majority of the participation was on activities taken on in the Health and Medicine Division or the NAM. In 2014, as you can see in the slide, 84 of you served in a leadership role, 362 of you were committee members, 154 of you contributed report review process, and in fact, from 2005 to 2015, a 10-year span, more than 1,100 of our members volunteer in some capacity on behalf of National Academies. That is truly a remarkable and impressive number. So, if you think about this, many current studies and activities underway in HMD, Health and Medicine Division, and all are being led by NAM members, overseeing consensus studies, chairing board committees, leading forums, roundtables, and moderating workshops. I'm so grateful to all of you who have continued to volunteer your time for the academies. I've had the pleasure of working closely with many of you on a range of activities. I can tell you I truly appreciate your continued advice and support. I know I can count on you, and that means a lot to me and, of course, to the Academy. I can't emphasize enough our members are the National Academy of Medicine. So membership engagement is essential to NAM's work, and I'm always looking for new and meaningful ways to involve you. Certainly in this past year, we generated an informal monthly newsletter to keep you abreast of recent development with an open invitation for feedback and suggestion. This has been very well received. As you will hear, NAM is undertaking a strategic planning effort to guide the next phase of the Academy. I'll discuss that later, but when I asked for volunteers to serve on the planning group to ensure balanced representation of ideas, disciplines, more than 60 of you stepped up right away. Yesterday at the town hall meeting, we launched the first annual business meeting where the NAM officers reported to membership about our progress, activities, reviewed our finances, and engaged in more direct, open conversation with you. We want to be transparent, we want to engage, we want to be communicative. So to increase engagement with the scientific and health communities, we've now decided to hold the annual Rosenthal Symposium outside Washington. Starting this year in Seattle, we'll be taking it on the road. Going forward, I hope to engage even more of you through the interest groups. I met with the chairs yesterday and really have a way to connect all of you closer to the Academy. So at this point, I'd like to give you a report on my assessment of the reorganization of National Academies, which took up a large portion of my time and energies this past year. First, becoming a full Academy affords us even greater opportunities to act as a field leader for health and medicine. With the reorganization of National Academies under the umbrella of National Academy of Sciences, Engineering, and Medicine, we have taken a major step forward to integrate, collaborate, and take a cross-disciplinary approach to our work. Because in partnership with NAS and NAE, the NAM now can more easily draw upon expertise across the disciplines and domains to advance science, policy, and practice in research, health, medicine, and the many intersecting fields. Together, we have a once-in-a-lifetime opportunity to continue to define our Academy and chart its course for the future. The key to success of the National Academies, as you all know, is our reputation for integrity, trustworthiness, independence, and credibility. So the National Academies of Medicine's goal is to be the nation's, and for that matter, the world's most trusted source for sound advice on science, policy, and practice related to health. We are committed to applying scientific rigor and objective evidence to achieve balanced, authoritative solutions to complex challenges. We generate momentum around critical issues, marshal diverse expertise to build evidence-based solutions, inspire action through collaboration and public engagement, and help develop the next generation of leaders and innovators. So now, with the reorganization, we are better positioned to lend health and medical expertise across the entire academies, collaborate with other fields such as social sciences and education, earth and life sciences, physical engineering sciences, and transportation. You know, we have long believed that health impacts should be considered in all policy decisions. So, the three academies now equally oversee all of the work of the National Research Council, or NRC, and its divisions. For a long time, both internally and externally, we saw health and medicine programs belonging solely to the IOM, under the governance of the IOM Council. And the old IOM had less of a role in the work of the other NRC program divisions. With this new integrated structure, we're better positioned to respond to a rapidly evolving and interconnected world. Thus, going forward, NAM supports and promotes all work related to health and medicine at the national academies, whether it comes from a health and medicine division, division of behavioral and social science education, division on policy and global affairs, or any other program units. Now more than ever, all of us are working across divisions and academies towards common goals. So indeed, the reorganization, with that, there are many more examples of NAM members serving on NRC divisions, non-HMD boards, forums and roundtables, and report review committees. Members such as Nancy Adler, Alto Chero, Bill Stead, Ellen Clayton, Angela Diaz, Keith Yamamoto, just to name a few. And importantly, we're now at the seat on the governing board, with Steve Hyman, Lynn Goldman, Tachi Yamada, and myself are now serving on the NRC governing board. So as a full academy, we're already taking a major step forward in terms of integration, collaboration, and cross-disciplinary work. Now, the NAS and NAE for a long time have long-standing defined roles of responsibility with the NRC and its division, including oversight, reporting, accountability, and financing. Well, these roles and relationship is now serving as a guide for NAM and its relationship with the other academies and NRC divisions. Now, if you agree with me, I think timing of this opportunity couldn't be better. As I mentioned before, I believe a forging convergence across discipline is how we move the needle in today's complex landscape. So in keeping with this spirit, while individual activities of three academies are branded as those of the respective academy, NAS, NAE, NAM, all our consensus report from the program units now are branded as reports from the National Academies of Sciences, Engineering, and Medicine. So no longer we have IOM reports, NRC reports, they all can be branded. And I think it's wonderful because we are part of the National Academy of Science, Engineering, Medicine. I believe this cohesive branding better communicates the cross-disciplinary approach that we apply to all issues. Of course, change always brings challenges and confusion. We're working really hard to explain the reorganization to our staff, to many of you, and mitigate the anxiety and confusion among our staff, members, and stakeholders. As a new academy, we also have to work hard to recruit and develop a new senior leadership team, that including a new executive officer, Mike McGinnis, a new chief of staff, directors of development, finance, administration, and communication. But I'm very pleased to report to you the work is now complete, including Judith Shamir's replacement. And I'm so confident now we have an outstanding team which will lead this academy into the future. And I'm also pleased to inform you the operations and finance are now in very good shape. So in the midst of all these changes, it's important for us to remember one thing that will never change, the pride we have in our IOM roots. The staff from IOM, most of whom now work in HMD, share our mission, our history, our kinship. We're firmly committed to building and extending the synergy of close ties in all that we do together with HMD, but also across all the divisions as it relates to health and medicine. So at this point, I'd like to review the programs and initiative of the NAM. I already mentioned 2 initiatives, but I want to look at it, take a step back with an eye to the future. So when I began my remarks, I told you a couple of initiatives. Now I'd like to first tell you about outstanding programs, which is shown on the next slide. So one program, Leadership Consortium for Value and Science-Driven Healthcare, is led by Mike McGuinness, and it's working towards a continuously learning health system. Through the consortium, national leaders, organizations, and agencies are working collaboratively on efforts ranging from digital interoperability and advancing a new paradigm of real-time evidence generation to accelerating progress on value-based care and full engagement of patients and families in care decisions. Second, as you can see, is the Innovation Incubation Program, a brand new program led by Kimber Bogart. It champions innovative ideas and cultivates pathways to action so as to increase our impact on the future of health and healthcare. Right now, Kimber is working with numerous states in the country to develop a plan based on the recommendations in the report, Transforming Workforce for Birth to Age 8, a Unifying Foundation. And third, of course, we have the health policy education programs and fellowships led by Marie Michnick, which is designed to foster the next generation of leaders in health and healthcare. And I'll talk a little bit about that later. So in addition to these programs, we're launching a number of new initiatives shown on this slide. On the top is the Culture of Health. The Culture of Health program is well underway. It's a program, a collaborative and National Academies-wide effort led by NAM to identify types of successful and sustainable practices and policies and partnership. The ultimate goal is to scale effective efforts and promote health equity so that every person can achieve good health and well-being. We're grateful to the Robert Wood Johnson Foundation, which has provided a grant and endowment to support this 5-year program. In just a few months, the first consensus study from this program, which is focused on community-based solutions to promote health equity in the U.S., will be completed and released. You know, at this time, I'd like to personally acknowledge and thank the NAM member, Risa Levisamori, president of the Robert Wood Johnson Foundation. Is Risa here? So after 14 years of trailblazing work, she's been a tireless advocate for health equity for all Americans, and under her tenure, the foundation has taken on many bold and transformative initiatives on childhood obesity, a great topic today, and building a culture of health, among others. So Risa, thank you again. Another area I know many of us are well aware of is this growing burden, as you can see in the lower right-hand corner, of stress and burnout among physicians or clinicians. My clinical friends and colleagues are faced with so many demands and stresses these days, and they're overwhelmed with workload responsibilities. And you know what? Some alarming trends are emerging. Recent research indicates that physicians have twice the risk of burnout as the general population, and the rate of serious problems such as depression or suicidal ideation among them is also alarmingly high, around 39%. And it's not just the physicians. Nurses and other health professions struggle as well. You know, this could have terrible consequences not only on the clinicians themselves, but also for the profession and importantly for patient care. So in July, at the urging of AAMC ACGME, AMA, we convened a meeting to discuss these challenges and explore future actions. In a testimony to the intensity of interest, 30 national associations, as well as federal agency and other stakeholders, all came to this building and actively participated in exploring what we should do in the future. As a follow-up, I'm pleased to announce that NAM will lead a collaborative platform on clinician well-being and resilience that will catalyze stakeholder engagement, perform root cause analysis, all of which may lead to a consensus report to recommend changes in work-life environment and national policies to reduce clinician stress and burnout. Again, I welcome participating all of you in this effort. Don't hesitate to reach out if you think you'd like to be involved. Finally, on the left-hand side is an initiative which I've discussed previously, have launched, but still moving carefully, is a grand challenge in health and medicine, led by a working group chaired by Bob Horwitz. This initiative is a bold call to action around the world's most pressing health priorities. As an example of a grand challenge of our time, it could be aging and longevity, highlighted by last year's annual meeting. In fact, I recently distributed a questionnaire to all of you, and I asked what you thought were the most important issues for NAM to focus on. Guess what? Aging was at the very top. Well, when you look around this room, I can see why this is obviously an issue of great concern to many of us. So through our Grand Challenge Initiative, we are going to pick these topics, spur innovation around this and others, marshaling resources, developing collective solutions where game-changing potential is great. And we're actively working in those areas and raising money for it. And you'll hear some more about this. But as an Academy of Health and Medicine, we are really committed to advancing science and increasing impact on society. In this context, we and the NAS team together teamed up to undertake the Human Gene Editing Initiative. As you know, researchers all over the world are using these powerful new gene editing technology, CRISPR-Cas9, which can revolutionize many areas of science and medicine and provide potential treatment and cures for disease. However, these technologies also raise a number of ethical and social concerns, specifically on the issue of human germline editing and gene enhancement. I'm very grateful to Keith Yamamoto, Bob Horwitz, and Mark Fishman for coming up to me at a council meeting and encouraging NAM to take on this very important and controversial area of science. We convened an international advisory group chaired by David Baltimore and invited the Royal Society and Chinese Academy of Science to join us in holding an international summit last December on the responsible conduct of this research. This summit was attended by representatives of more than 20 countries, viewed by thousands more worldwide via webcast, and generated headlines around the world. But more importantly, currently we are doing a study committee co-chaired by Altachero and Richard Hines, NAM members, on a consensus report that will provide a framework and recommendations on responsible gene editing research, and of course, eventual application that could also, of course, be adopted by other nations. As you can tell from all these examples, our Academy is on a great trajectory. We're already making so much progress over this last year. So you may ask me, where do we go from here? As a new Academy, we now have the opportunity and responsibility to collectively define our vision, our mission, and our goals for the coming years. Over the summer, we convened an initial working group to formulate the mission statement with oversight from an NAM Council. This was the first step in a comprehensive strategic planning process. We reviewed the draft in an expanded leadership meeting in July that included NAM members, but non-NAM members, HMD board and committee chairs. And last month, we sent the draft language to all of you, our members, for feedback. And we got a tremendous positive response by many of you. So thank you very much. And as you know, in the town hall meeting, we discussed this, and certainly we're going to try to further refine those statements. So now I'm pleased to share with you our draft mission statement. It is to improve health for all by advancing knowledge, accelerating progress in science, medicine policy, and health equity. Let's sink in for a moment. Health for all. The notion of combating health disparities is built in this statement, as well as the notion that we want to improve health not just domestically, but globally. Next, we want to both advance knowledge. That means generating new research and finding synthesis in research and education, and accelerate progress. We strive to increase the pace of research and its translation into clinical practice and evidence-based policy decision. Finally, we believe health equity, a foundational value and important goal. We decided to call it out in our mission statement, especially now, I think, this time, which is so important. I hope all of you see yourselves reflect in this mission statement. For me, it's been an inspiring and illuminating process to crystallize the essence of our work in this way. And there's still more work to be done. So over the next few months, we'll be expanding the strategic planning working group to include some of you, or many of you, who volunteered, and developing a full strategic plan for the NAM. The details are noted on the slide. Those who attended yesterday's town hall meeting participated in a very helpful discussion about this. I thank you most sincerely for your insight and enthusiasm, and want to continue to engage you throughout the process. So in February, as you can see in the slide, the NAM Council and the working group will hold a 2-day retreat to craft a strategic plan, and we anticipate that we'll have a final plan in April. Once set, that plan will guide our work for the next several years. Included in strategic planning is a consideration of the future of our membership. You know, it's ideal time to think more deeply than that. Excellence is always and will always be the most important criteria for Academy membership. We must capture excellence that courses through the entire diverse range of ages, race, geographic areas of expertise, and also at the same time anticipate the skill sets and backgrounds that will be needed in the future. So what changes do we need to make? Well, what will our future membership look like? These issues were explored for the first time at a membership policy retreat in March, led by Jane Haney, our Home Secretary. But any future decision will no doubt take much more time, thoughtfulness, and careful consideration, and of course, engagement with all of you. Our goal is to be inclusive of people of diverse generations, cultures, and experiences. As I mentioned, we have several fellowships that bring promising health policy trainees with different backgrounds to national academies. In addition, you'll hear a little bit today at lunchtime, through our DC Public Health Case Challenge, we'll connect with local university students to promote interdisciplinary, problem-based learning around the health issue that faces the DC community. And now, with the help of Maria Michnik and support of Council, we just created a Young Leaders Forum, which can be seen in this slide. It's made of a dozen young professionals who really represent the future of science, health, and medicine. I met with them for the first time yesterday. We discussed views on how to engage them more and how to involve young leaders in NAM's work. And I have to tell you, I was really inspired by their passion, their insight, and I look forward to working with them in the future. So please stay tuned. So, I've covered a lot of ground today, and who we are and who we wish to be, or hope to be as Academy future. Let me say that the NAM will always be a society of exceptional scholars, scientists, clinicians, and leaders. But we are also so much more. We are an academy with purpose. We are the nation's independent, evidence-based advisor of health and medicine. We are collaborative, interdisciplinary. We're a national academy with a global scope. We're committed to catalyzing action and achieving impact. So no matter what happens in the next presidential election, or years after that, we'll continue to be the truth meter, right? Yes. And depending who gets elected to White House, we can be kept very busy doing this job. All kidding aside, we have for many years provided evidence-based advice that rises above partisan politics, and we always will. Of course, none of this would be possible without your hard work, your service, your unwavering dedication to a cause that's bigger than ourselves. We are together because we know this academy what this academy can achieve. As Woodrow Wilson once said, oh, I lost my slides. Can you just advance it? 2 more slides, don't worry. Have you memorized all these slides? Keep going. Great. Next. There. My punchline. There's no cause half so sacred as the cause of a people. There's no idea so uplifting as the idea of service of humanity. As we're here today, recognize the truth of these words. Ultimately, we're all here because we want to leave the nation and the world better than we found it. Together, I sincerely believe we will. So in conclusion, I'd like to turn to a time-tested African proverb. You want to go fast, go alone. You want to go far, go together. Indeed, together, as an academy, we can make a big difference. Thank you very much. Thank you.